So very interesting, insights that you gave in this particular question, which actually I have 3 follow-up questions of this. In simple terms, can you explain the difference between remission and reversal?
So it's a terminology. So remission, it's a more of a technical word. Reversal is it's not so accurate, is what I feel, because people get false hopes that it's gone for good and now I can get back to old me, but that may not be the right thing. So any reversal, if we don't stick with what worked at the first place, it's going to come back. Like every bad thing in life, I mean, if you are not disciplined enough, it's going to come back. Similar way, if somebody is lucky enough that lifestyle measures have worked for them, losing some weight, it's a very well-known thing since decades. Thousands of patients, it has been studied on, and it has been proven losing around 5 kg or so causes diabetes remission, you may say it. Diabetes goes away. And for how long it goes away, that will be answered by 2 things. One is how strong your family history is, your genetic history of diabetes, risk of diabetes is. And second is how diligently you're able to follow the things that worked for you in the first place. So it all starts, the mental approach to it, the mindset is the core. So that, decides how effective everything else is going to be. Yeah.
Okay. For someone, who has never heard of insulin resistance, you told, insulin resistance.
Yeah.
What is insulin resistance?
Insulin resistance is the culprit. So if you had to, find the culprit who is doing everything, what's happening, that would be the guy, insulin resistance. And you would be surprised to know it's not just diabetes. So insulin resistance is related to PCOD. It is related to heart disease, diabetes, of course, fatty liver, cholesterol. So insulin resistance could start at even teenage. It could start, say, 10 years before somebody got detected for diabetes. These things start early now, with poor eating habits among adolescents, and overconsumption of processed foods and various other factors, sedentary lifestyle, physical activity has gone down. So insulin resistance starts early, and that's why you have so many of young girls with PCOD now. They are related to each other. PCOD is as much as a metabolic problem as much it is a hormonal problem. So insulin resistance is the culprit of all. Now, these days it's easy. It's a simple test to test your insulin resistance. And we come across people who have a family history of diabetes, who are, say, pre-diabetics themselves. So rather than sitting and waiting, so what do we wait for when we know, okay, this guy, I have a strong family history of diabetes, I am obese, I am slightly overweight, which so many of us are, and I sometimes may not eat so healthy. So I know deep down I am at high risk of developing diabetes. What do I do in this scenario? I'm not able to change my lifestyle right now. So this is a sample scenario here. So what is this person supposed to do? Sit and wait for diabetes to happen? So now we have insulin resistance can be checked. It is a measurable metric. So if today my insulin resistance is this X level, and I want to do something about it, and I do that, I can check it 3 months, 6 months down the line and see how effective things have been, what I've been trying to do to bring it down. That will directly bring down my risk of developing diabetes. It will push away onset of my diabetes by few years, even more. So that is insulin resistance. Good. More and more people are getting to know about it. Now it is more commonly being used in clinical evaluation of patients, even in deciding that what treatment would be the right treatment for which person. So these things, these parameters, they guide us in making the right choices.
We started off the podcast talking about there is so much knowledge, information, and you also said right now, insulin resistance, people know about it and everything, right? There's also an upside down for this. People get to know about things, they start doing self-diagnosis, yes, self-medication. They do, FUD methods of doing this. What are the most weirdest cases that you have seen?
So another story comes to mind, and this cute old lady sitting in my chair, and something came up about in the during the consultation about mangoes, I guess, and she started sobbing. That ladies kept crying there. Uh, when I asked her, she says she hasn't had a mango in 7 years. Just because somebody told her you're a diabetic, you can't have a mango. Since that day, all my patients, I remind them to have a. It doesn't. So lack of awareness and knowledge again, right? They might leave a mango or a natural fruit and go have two biscuits maybe, just because somebody's told they were okay to have. See, I'm totally with people who do that. I am in their support. People who are checking things, trying to, they are, the half the job is done there. These are the people who are looking for better health. They want to live better. The job is done. Now they just need the right hand holding, and somebody should assist them in this journey. So intent is the biggest thing. So when the intention is there to learn about the basic health knowledge or awareness, to live better, to have a better quality of life, we are good, we are here for you. So if somebody wants to know, yes, our system is still, because these things, like we discussed, these things were silent, so nobody could feel the illness happening inside them, and that is why maybe enough knowledge or awareness does not exist, but things are improving, and that is why we should talk more about it. People should know better, because most of us, we have the family history of diabetes, blood pressure, heart disease, and the way we are seeing things happening now, we still are not ready for what's coming. I said, 1/4 of our country, such huge numbers. This could make COVID look small. We are not ready. We are not ready for what is coming. Younger people getting these issues, so they live with it longer, higher risk of them living with complications. And that is why it is so important that we understand and target these issues while they are silent, while they are not very evidently troubling us.
I also observed in all your answers, you took fatty liver, cholesterol, blood pressure, diabetes all together. So, and you also mentioned that they're close friends. Yes. Right. So, how are all these linked? Are they linked? So, if someone with blood pressure, he's like, okay, I'm going to go to a doctor. I'm going to go to a general physician, check my blood pressure. If it's high, I'm going to take some tablets. How is he in danger of diabetes?
Yep. Great question. So, um, that is why they are all called metabolic illnesses. The We call it pathophysiology. So basically, what is happening inside, apart from normal, they are linked to each other. That is how the concept of holistic health comes. Holistic health is the whole person should get better, not just their report. They should feel better, they should live better. Similar way, these things also work together. So if somebody's bad cholesterol is increased, triglycerides, HDL, good cholesterol is low, they are at risk of fatty liver. Excess fat will deposit in the liver. And now fatty liver is the biggest cause of liver damage, even more than alcohol now. So that is why fatty liver is important. Once somebody has fatty liver, their risk of getting diabetes goes up by 3 times. Heart disease also. So because it's metabolism, when the liver is not working well, this guy cannot burn enough sugar. So that is how these things are interrelated to each other. Similar thing with blood pressure. Now cholesterol is for heart health. If heart is stressed due to our mental stress or physical stress, obesity, excessive fat, fatty liver, or diabetes, heart is going to go weaker because he has more work to do now. So these organs, they go under repeated stress, and these metabolic issues, they keep cropping up one after the other. And when we are dealing with more of these issues, it's harder to control. That is why early detection, good awareness, and prevention is the best policy when we are dealing with these metabolic issues.
So, now, are there any difference of symptoms between how a man would get diabetes and how a woman would get diabetes?
The thing is, the symptoms, so-called symptoms of diabetes, they have been generalized too much, and people shouldn't look too much into it, because so many of diabetes are just silent. regardless of family history, regardless of patient profile, regardless of sex also. So, the classical symptoms of a diabetic, urinating too much, losing weight, and then checking his sugars, those are called osmotic symptoms, and that everyone may not get it. So many of people, they get on a routine checkup, surprisingly, they see their sugars to be high. So no, not really. There is not much difference based on sex. Diabetes onset can creep in for years, like we discussed, insulin resistance, insulin reduced secretion, and these things can keep going on. And when they are coupled, on top of that, if we are loading a lot of carbs, which we all of us, most of us do, if we are loading a lot of carbs, we are not being physically active like our ancestors used to be. So then we our risk of getting these diseases, these metabolic issues, becomes higher.
Okay. You you talked about routine checkups, right? Now, for someone who doesn't know that they have diabetes, or because it's, as you told, it's a silent,
Yep.
there are no symptoms at all. When you say a routine checkup, what is like the standard, approach for someone to get the routine checkup, or is there any age limit? Like you even mentioned that even teens are pre-diabetic right now, right? So is it like, okay, I'm 15 or 16 years old, let me get a test done to my kid. So what is the golden standard or golden rule that you would recommend?
So it again depends on the clinicians, the doctor's assessment of the person. So somebody going blindly to a lab and doing some test, we may not know what we are looking for. So a thorough, careful assessment of somebody's personal lifestyle, their family history, what kind of diabetes or blood pressure or heart issues existed in their family, because that is a very strong predictor. So we have scoring systems, by the way. So and they have existed for many years now. So scoring system takes into account, say, your weight, any risk factors such as smoking, or family history of certain illnesses, and certain reports if they are already known to be abnormal. This scoring system will very easily give the risk stratification of the person. But that is why it is important, it is better if before we discuss with our doctor, be it for any age groups, the doctor could assess you and feel that this test is important for you, more important for you than any other test. Insulin resistance is one of those things. Maybe checking, doing an ultrasound of stomach looking for PCOD is one of those things. So these things will never crop up in a routine checkup. But based on patient's assessment, what risk the person has, what the person is more prone for, will be able to give us the right test required.
So when you said smoking, it reminded me about co-working places, including a smoking zone. And when we think about co-working places, it's about sedentary lifestyle, people in IT jobs. They smoke because they say it reduces my stress, no sleep, right? Does stress, sleep impact insulin resistance?
Absolutely. Absolutely. So we spoke about holistic health, how we are one, our mental health. So the definition of health is a sound body in a sound mind in a sound body. So it is as important what we are doing, what kind of lifestyle we are following. If we are trying to be active and not getting enough sleep, we are still at high risk. If we are high stress, we are still. So a balanced approach. These days it's easily said than done. We are living in high stress lifestyles, but it is very important, and maybe that is why we are seeing so many of young people getting heart problems and sudden unfortunate incidents happening around us, because we are living through the highest stressful times that have been. So stress handling is important part of diabetes treatment itself. So behavioral therapy, how do we have the right mindset and right approach while handling these things, is as important as the pills we take or the exercise we take.
So if someone wanted to start tracking all of this from today, what would be the right start point? Because you told it starts from teenagers till, it can even show up 10 years later, 20 years later. What are the few basic steps if someone wants to start tracking from today?
So meet your doctor, understand where you stand currently in terms of your metabolic health. Also discuss what are you prone for. What are your risk factors? So these are the things which are a big no for me. These are the things I can do still in moderation, and these are the things that are good for me. Those things may vary from person to person. I cannot handle 12 hours working. You like it, you like the hustle. So we are different, but staying mindful and aware is where it all begins. And your doctors are always there to show you the way. So, having an open dialogue with your doctor, understanding where you are coming from and what could be the risks for you in future, that is the long term approach. And then your doctor will advise you based on your parameters that you need a 6 monthly checkup, you need a 3 monthly. People who are say diabetic and have blood pressure, we sometimes tell them to do a proper 3 monthly follow up, because there are so many things to monitor and check. People who are healthier, or not on so many tablets, we sometimes tell a longer duration of follow up. But following up, it's like anything else. We have things, right? We have our vehicles, we have our water purifiers and cooking gas, that we get it serviced regularly, right? But those are just things, and we about ourselves, our human body, we neglect it. So this thought process, the perception change has to happen a little bit. It's happening. So if we give more importance to our health with regular, timely, periodic checks and follow-ups and consultations, definitely things will get pre-detected. Things will get detected. We will find out things before they become bad, and that is what will give us better outcomes in the future.